This video is a virtual anatomy lecture series directed by Dr. Strategy using Anatomage table. The manipulation and the annotation was done by Dr. Mai by Truong. The English script was monitored and recorded by Ms. Soyeon Kim, the PhD candidate. You can learn human anatomy easily with SNUSD Knowledge Share Initiative.
Let's continue with the lower limb. There are 32 bones found in the lower limb. Hip bone, and the three bony components are ilium, pubis, and ischium. Femur, patella, tibia, fibula, and bones of the foot. Let's talk about the pelvic girdle first. The pelvic girdle is formed by a single hip bone. The hip bone attaches the lower limb to the axial skeleton through its articulation with the sacrum. The right and left hip bones, plus the sacrum and the coccyx together form the pelvis. The hip bone, or coxal bone, forms the pelvic girdle portion of the pelvis. The paired hip bones are the large, curved bones that form the lateral and anterior aspects of the pelvis. These bony components are the ilium, pubis, and ischium. All three bones of the pelvis, the ilium, ischium, and pubis, together form the acetabulum. The acetabular margin forms 3/4 of a circle, with a deficiency located antero-inferiorly called the acetabular notch. The lunate surface is the horseshoe-shaped articular superior surface of the acetabulum for articulation with the head of the femur. The acetabular floor has a rough depression called the acetabular fossa. The obturator foramen is the large opening created by the ischium and pubis bones through which nerves and blood vessels pass through. Let's talk about the ilium first. The ilium forms the large, fan-shaped superior portion. This curved, superior margin of the ilium is the iliac crest. The rounded, anterior termination of the iliac crest is the anterior superior iliac spine. Inferior to the anterior superior iliac spine is a rounded protuberance called the anterior inferior iliac spine. Posteriorly, the iliac crest curves downward to terminate as the posterior superior iliac spine. More inferiorly is the posterior inferior iliac spine. This is located at the inferior end of a large, roughened area called the auricular surface of the ilium. The auricular surface articulates with the auricular surface of the sacrum. The shallow depression located on the anteromedial surface of the upper ilium is called the iliac fossa. The iliac tuberosity is a roughened area located inferior to the crest and posterior to the iliac fossa. The large, inverted U-shaped indentation located on the posterior margin of the lower ilium is called the greater sciatic notch. The ischium forms the posterolateral portion of the hip bone. The large, roughened area of the inferior ischium is the ischial tuberosity. This narrow segment of bone is called the ischial ramus. The slightly curved posterior margin of the ischium above the ischial tuberosity is the lesser sciatic notch. This is the greater sciatic notch. The bony projection separating the lesser sciatic notch and greater sciatic notch is the ischial spine. The pubis forms the anterior portion of the hip bone. The enlarged medial portion of the pubis is the pubic body. Located superiorly on the pubic body is a small bump called the pubic tubercle. The superior pubic ramus is the segment of bone that passes laterally from the pubic body to join the ilium. The narrow ridge running along the superior margin of the superior pubic ramus is the pectineal line of the pubis. Extending downward and laterally from the body is the inferior pubic ramus. The inferior pubic ramus extends downward to join the inferior ischial ramus. Together, these form the single ischiopubic ramus. The pubic body is joined to the pubic body of the opposite hip bone by the pubic symphysis, like this.